With those 12 potential Democratic defections, Speaker Pelosi does not have the 216 votes she now needs to pass that Senate health care bill. That means she'll have to convince some of the 39 Democrats who voted against the House version of the health care bill back in November and get them to change their minds.
Joining us now from Capitol Hill, a Blue Dog Democrat from Pennsylvania, Congressman Jason Altmire. He voted against the health care plan in November, the House version, and now has an opportunity, it would seem, to vote for the Senate plan. I guess my first question to you is, did the president really try to twist your arm last night? I know you were over there at the White House. What did he say? What's his pitch?
The context of the White House meeting last night was a celebration of the enactment of pay-as-you-go budgeting. So that was the discussion, how health care fits into deficit reduction. And the president did have some pretty strong words on the ability of this bill in particular to reduce the deficit, but of health care reform in general to bring down the cost of health care for businesses and for families, but especially for the governments.
Was he convincing? Are you willing to become a yes vote?
I need to see the details of what the final bill is. The legislative language is not completed. The CBO has not scored the bill. So if the conversation is going to be about debt reduction, I need to have some independent validation of that.
You know, I think it was in the New Republic yesterday, a former Obama healthcare advisor wrote that this is a blue dog dream, the Senate healthcare bill, as well as the fixes. There's no more public plan. That millionaires tax is out. There's now more cost containment policies. There's even some medical malpractice reform that some of the blue dogs like to see. So whether you vote for it or not, is there a better chance you vote for this because of how this bill has changed from the one that was in the House?
Chuck, I think everything you just said is absolutely correct. The concerns I raised about the House bill, the reason I voted no was I didn't think the income tax should be increased as part of this. I didn't think there should be a small business employer mandate as a part of this. And I didn't like some of these other ideas that have been taken out of the bill. So where we are now is definitely a better starting point than where we are in November. The question is, how do we get the votes from here and what needs to be nailed down as far as the finished product?
And Congressman, do you trust the Senate to pass fixes to this bill via reconciliation, or do you want some kind of guarantee? Are you having trust issues with your colleagues over there in the Senate?
I think we have an obligation as members of the House to make the tough votes. I'm not worried about casting a vote based on what my constituents want me to do. I know there are some members who got hung out to dry on cap and trade and other difficult votes, but hey, I was sent here to make tough votes. I'm not worried about that. Obviously, for it to become law, the Senate's going to have to do their part, but I'm not afraid to take a difficult vote.
All right, Jason Altmire from Southwest Pennsylvania District there. I assume you have to be a Steelers fan if you even have a chance
Steelers, and don't forget about the Penguins, though.
And Sidney Crosby, the big hero. That's right.
Even I know that.
We're proud of him.
All right. Jason Altmire, thanks for joining us. And thanks for sharing that perspective about your White House happy hour last night.
Well, Chuck called it that, not you. Okay.